Hi, Support Fibro friends. It's Melissa. I wanted to jump on and just check in with all of you, do a Support Fibro organizational update and what's to come and what to stay tuned with. Also wanted to check in with everyone, just see how everyone is doing. It's long months ahead. There's maybe a lot going on. So if you're tuning in live, please say hello and let us know where you're tuning in from. I'd love to connect with you, and it's just great connecting with more people through these live broadcasts coming up. If you have other suggestions on content that you would like to see in these live broadcasts, please let us know by leaving comments or sending us a direct message and private message on any of our accounts. I know we kind of lag sometimes on Instagram because we're trying to get better at that. I have some ideas moving forward, but I would love to hear from you on the content that you're kind of missing or eager to learn about when it comes to fibromyalgia. I get a little particular on not necessarily repeating content because I know a lot of it gets redundant and it feels like we need some more and elaborate information. So that's why I kind of wanted to just ask and keep asking and polling of all of you to hear like from you what kind of content you'd like to see, or if there's other guests. We've reached out to other speakers as well. So we're going to be continuing those events, trying to do live broadcasts or pre-recorded information as we can find these guests and bring them on with different and unique content perspective that might be interesting to you. So please share with us and let us know what kind of content you'd be looking forward to. As far as organizational updates, we do want to talk a little bit more about COVID-19 and just some of the vaccine questions. So if you have any questions right that, please let us know. We're going to be doing a special community connect with our good friends Looms For Lupus. So we'll be sharing more information and having a good open discussion about where we are at with COVID-19 and what things look like at this point in time. And we'll be giving some different resources on that community connect, and we'll have more information on when we're doing it. I think maybe Friday morning this week. So hopefully we'll get it locked in later today. I'll talk to Looms For Lupus and we'll get it worked out, because we wanted to share more information with you and just to address the immune compromised community, because it does come up and people feel like they're not getting enough information. So we wanted to address this in another live video for you with bringing in Looms For Lupus and really talking about both fibromyalgia and lupus together and maybe some other communities there. I did post a link for anyone that's interested from a functional medicine perspective of any like pre-vaccination protocols that you might be interested in. So we can go more into depth in that video when we team up with Looms For Lupus, but I did want to share this link with you in case there is more questions and stuff on just preparation. Please, if this is something that is on your mind, because I have been getting a lot of questions regarding the vaccines, really work with your doctor and hone in different possibilities. And that's what we'll get into more on Friday. But it's always good to be prepared in advance and have these discussions with your provider and just always be prepared for what you would need when it comes to this. So I look forward to that discussion coming up hopefully later in the week. We also are going to be having, I'm going to go through the food access survey, at least where we're at. Thank you to everyone who filled out the survey so far. We have 350 responses to the food access survey. So I'm excited to go through and just share where we're at with the information. It was insightful, especially the comments. So what was really insightful with the food access survey was the comments that people left. So even though it may not seem that food access or food insecurity comes off as severe when we're doing some of the questions, I really noticed from the comments where people are at with affordability of food, where nutrition falls. There are some barriers to some of the food access that we did notice. So people are looking for more nutrition information, which we'll have and start presenting. So that's good and helpful. Access to food, finding enough energy to shop for food and enough energy to cook the food. So those were a few other barriers that came up with the survey, especially in the comments. So we'll go over that, but I want to make sure that we go through the responses with you. And if you have other people that you know are in need or struggling with food access, please reach out and let us know. It's something that's very close and near and dear to my heart, especially on the education front, how to shop appropriately to get nutrient dense food, because all of us are being told to get more nutrition in our lives for value and health benefits. So how can we do this with limited amount of energy and like managing our symptoms as well? So I'm going to like be organizing a presentation about that just to help, and maybe even have an open discussion and roundtable, because I hear this a lot too with the health coaching. Affordability, organic versus non-organic, like frozen foods, canned foods, like all these questions come up with affordability. So I've been watching too a lot of those grocery hauls where they go through, and it's really coming down to the fact, like, if we can try to find enough energy to cook for ourselves or even make smoothies. I love making smoothies because you throw a lot of stuff in the blender, just blend it up, you get a lot of nutrients there. And for me, it's easier for my gut to digest blended foods anyway. So this is kind of like the momentum I've picked up and what I had to do to like reboot, because I'm not a natural born cook, nor did I have a lot of energy, especially for shopping and those things, and then coming home and chopping up all the vegetables and cooking. But there's different tips to kind of go through with that, with batch cooking and stuff. So we can get more into that and answer some of the barriers that came up in this survey. But I do want to present that content to all of you to understand. And we're still collecting information because we still want to reach more people and diverse groups of people, especially people living in food deserts, rural parts of the country. I want to dive into more of your food access and just things that are coming up. There was affordability stuff because people are having to choose between medications or nutritious foods. But I think when we break down nutrition a little bit more with practical application of everyday use and what you can buy and look at it a little different, I'm hoping that will help. Because I've learned a lot in the coaching groups of where people see that they need to be versus like what's actually possible. And learning from Dr. Terry Walls, it's been incredible because she's worked through the VA systems, worked with a lot of people on disability. And I've learned a lot of what we can do and how we can move forward when it comes to adding nutrition back into your lives, no matter where you are at where you are at right now. So I think that's super important to me. And I know I've seen some conversations on social media that it's definitely the benefit of nutrition. This isn't going to be an approach of like cure all when it comes to talking about different ways to get more nutrition into your life, but it's about nutrient dense foods and how to add more and sort of add the good stuff in and start to eliminate some of these foods that create more inflammation without judgment, because there are some good substitutes. So the best of, and you kind of like slowly walk your way towards different things that you can afford. So we'll kind of go through that as we move through some of the nutrition. But if you have questions, or maybe there's some protocols that you want to get into, or lifestyle factors, like if you're having trouble with things like AIP or want to learn more about FODMAP, please let us know. Definitely going to be talking about the Walls protocol quite a bit and starting out with like 101 and then going into some more details, and then also going through some of the paleo approaches. I know autoimmune AIP can be a little bit tricky because of all that you take out, but we'll really understand it's actually what you're like putting in, as opposed to always focusing on what you take out. So we'll get into more detail with that. Again, we just want to add some more guest speakers out there. If you know someone that is interested in being a guest speaker, we would love to have them on a live stream or pre-recorded as well. If anyone's interested, we're going to be doing some more advocacy updates as well, just addressing what's going on in the world and fulfilling the needs. We had some great discussions recently with some patient advocates forming more of an advisory community. So we're doing some outreach right now for a patient advisory committee. If you're interested, please reach out. We definitely would love different perspectives involved. So I'm excited because having conversations with other patient advocates, it gives us an idea of what's going on locally in their state and their community. And just, again, coming back to what the needs are of the community. We can't be blind to that as an organization. So what are the patient needs? What's going on currently? I know it's shifted, and, we are doing advocacy events and advocacy training in order to talk to our representatives to increase research, but we know that research may not be front and center for what's going on within your life right now, especially with the pandemic taking place. So you might have a lot of questions. There might be different things going on. I know we do get a lot of questions when it comes to applying for disability, Social Security benefits, all of that. And there's work actually being done on that side of things. So please just keep the comments coming, keep the communication going with our team, myself especially. See me in Facebook, add me, tell me what you're missing, what you're noticing from the fibromyalgia community is missing for information so we can hone in. We are working hard on getting this Project Echo launched so that we can start training medical providers, but it is a big mountain to accomplish when it comes to establishing curriculum that we can actually put for continuing medical education credits. Providers have been super busy lately, even more so now. So we have a hurdle to go to, but it is a huge focus to get medical education for fibromyalgia complete through Project Echo, because we want to democratize that knowledge, take out the bias, have the collective thought process together of our providers, and really reach all parts of the country, not just the major city hubs, but actually be able to train providers who are in rural parts of the country. It is super important to the organization we get this complete, but we also need to maintain connections on what the patient community, all of you right now, are looking and need information on. So shout out to a lot of people, the patient advocates I talked to recently too. I love the information coming from Katie at Painfully Living. So please check out her blog, and we'll be sharing content from there. We're always sharing content from the bloggers that we really appreciate on our pages too, especially if you're on Facebook. Please read them. Please support those blogger communities. It's very important. They love it when you read their work and share their content. So that's what we do, and we love it too. Stay tuned for just more information. Like I said, we're going to be doing that collaboration with Looms For Lupus hopefully this week. I think tentatively look for Friday morning. We're going to have a discussion later today, so we'll finalize it for you. But keep your questions coming in, and yeah, let us know any support that you need. I mean, it's really been a tough few months over here. I can be honest, I don't feel like I ever recovered from May, and it just went into like June gloom, and July I have a lot of people here who are really struggling. So I think it's just trying to make what we can work, and I understand what's really going on, and if there's extra support needed, please reach out. There's a lot of advocates out there too that are really wanting to contribute and help. I know, shout out to Latoya, she had a great conversation too on making sure people had school supplies that they need in her area. So she has something going on right now. If you need stuff, to just reach out to her. There's a lot of back to school events going on with some of the other organizations that we've connected with in different states. So there is a lot of support that you can tap into. So if you are needing it, please reach out. If we aren't necessarily the ones, if there's someone closer to you that might be able to get you the help and support you need, we'll definitely refer you. There's amazing organizations out there, grassroots. We're community together in a community hub, and the people we can direct resources right now, especially as things are coming. If you need supplies or just have any other questions, please definitely reach out. Thanks again. Again, tune in hopefully later this week. Bye, everyone.